You know, usually when we think about a hospital, there is this, I don't know, this underlying expectation of just absolute clinical precision.
Right, yeah. Like a well-oiled machine.
Exactly. Like it's almost a factory for fixing human bodies.
Yeah.
You walk in with a broken arm, they do the x-ray, and shows that jagged white line. The doctor points to it, gives you a diagnosis, and, well, that's kind of it.
It's clean. It's binary,
Right.
broken or not broken.
Yeah, and I think we find an immense amount of psychological comfort in that visible, measurable precision, especially when we are feeling vulnerable.
Oh, absolutely. When your body is failing you, you want the science to be exact. You want that illusion of total control.
But the reality of being a patient is rarely that clean.
Yeah.
And that factory-like view of medicine, it just doesn't capture the actual lived experience of being in a hospital bed.
No, it really doesn't.
The diagnostic landscape, the
Mhm.
charts, the scans, the lab results, that's really just one tiny piece of what actually happens to you in those rooms.
A very tiny piece.
So today, our mission is to look at a really passionate piece of source material, one that takes that purely clinical view of medicine and completely flips the hierarchy on its head.
It is quite a document.
Yeah, it's a tribute speech delivered on International Nurses Day from Narayana Multi-Speciality Hospital in Howrah, which is part of the Narayana Health Network. Okay, let's unpack this.
The core tension we are going to explore today is the profound difference between medical treatment and actual healing.
Which people usually think are the same thing.
Right, but they aren't. The source material from Narayana Howrah draws a very hard line between the infrastructure of medicine, like the treatments, the diagnoses, the million-dollar technology, and the human element required to actually make a person whole again.
It forces us to look at the mechanics of recovery from a completely different angle.
It really does. It's a fascinating shift in perspective.
We should probably start with how this text claims patients actually experience a hospital visit, because that establishes our baseline. There is a really striking quote early on in the tribute. It says, "When patients walk into a hospital, they often remember the doctor's diagnosis, but what they never forget is the kindness of a nurse."
That line really hits hard.
It does. And I was thinking about this, and the best way I can describe the mechanics of that memory is, well, it's like watching a movie.
Okay, the cinematic experience of a hospital stay. I like that.
Yeah, exactly.
Mm-hmm.
So the doctor's diagnosis, that's the plot of the movie. It's the sequence of events. You came in, you had this condition, the surgical team did this procedure, and you recovered.
It's the narrative arc.
Right. But the nurse's care, that is the soundtrack. It's playing under the surface the entire time, and it subconsciously dictates how you actually feel during that incredibly scary experience.
That is a great analogy.
Because years later, you might forget the exact details of the medical plot, right? Like the names of the medications or the specific blood pressure readings.
Sure, all the clinical data fades.
But if you hear that soundtrack, it brings the exact emotion rushing back. The kindness is the soundtrack of recovery, and it dictates the memory of the trauma.
What's fascinating here is the underlying psychology of why that happens. The text deliberately contrasts the cold medical facts of the diagnosis with the emotional endurance of kindness.
Because that's how we process things.
Exactly. That is exactly how the human brain processes a crisis. When you are lying in a hospital bed, you are stripped of your normal autonomy. I mean, you are literally wearing a gown that barely covers you.
Oh yeah, those gowns are the worst.
You're hooked up to machines, you are fundamentally vulnerable, and in that state, your brain's prefrontal